When should a parent suspect that the child is suffering from a rheumatological or immunological disease? So let's see the warning signs when a parent should become attentive and bring them to the care of a pediatric rheumatologist and an immunologist. So I will be dividing these danger signs into two broad categories. One is the danger signs for suspecting rheumatological diseases and the other for immunological diseases or low immunity. Danger signs for suspecting rheumatological diseases. If you see your child is having repeated fever, which is prolonged in duration, persistent, and not having a reason for fever, we need to think about a rheumatological cause of fever. Apart from fever, these children can have joint pains, joint swelling, severe pain causing change in the walking style, causing them to limp, and having difficulty as soon as they get up from the bed, that is early morning stiffness. Children may have pain and weakness in the muscles, and which causes weakness of these muscles and causes difficulty in going up and down the stairs, squatting down, getting up from sitting position. Children may have a varied spectrum of rash which can present on the face. Photosensitivity in that is the rash increases on sun exposure. Rash on eyelids, which is called a heliotrope rash, rash on knuckles and hands, that is Gottron's papule. Rash can be present on the trunk in acute infections like acute diseases like Kawasaki disease, and rash can be diffuse and it can spike with fever, disappear with fever in some diseases of systemic juvenile idiopathic arthritis. Some children can have oral ulcers, genital ulcers, red tongue, red lips, cracked lips. Some children can have visual problems, red eyes, decrease in vision can be seen in some autoimmune diseases. Before all this set in, children often give us some simple clues, that is extreme fatigue, loss of weight, loss of appetite can be seen. Apart from this, if you see a child who's having multi-organ involvement, the liver is affected, the brain is affected, and is having multiple issues, that also is a marker for underlying rheumatological illness and needs evaluation for the same. Now coming to the warning signs when to suspect that your child's immunity is low, or is there any genetic problem of immunity. If your child is having repeated fevers, repeated infections in the form of repeated ear discharge, repeated sinus infections, the child is having repeated cough, cold, and is having pneumonias needing admissions once or twice in a year and is needing oxygen therapy, then we need to evaluate for immunodeficiencies. If the child is not gaining weight, is having repeated diarrheas, is having skin infections, and is having pus collection anywhere in the body, from liver, brain, or simply the skin is showing multiple skin infections or abscess, we need to think about immunodeficiency. Similarly, if your child is having repeated fungal infections, whitish coat in the tongue which does not subside and keeps recurring again and again, we need to think about fungal infections which are due to a low immunity cause. If your child needs repeated admissions, repeated antibiotic usage, is not gaining height and weight well as the counterparts of his age, then it could be the underlying immunodeficiency which is causing problem for your child, and immediately we can evaluate and treat the child.